Okay, so air inside the lungs fall. So the air that is present outside is more as compared to the pressure of the air that is present inside. So the air rushes into the lungs from outside. So this is how inspiration takes place. So one half cycle of mechanism of breathing is complete. Then whatever we have inhaled, that deoxygenated air has to now come out. Now in that condition, expiration is more or less just the opposite of inspiration. Okay. So here also the same muscles work. The intercostal muscles, the diaphragm and the sternum, the thoracic chamber, the rib cage, they are only working for the process of expiration also. Now how this works? In expiration, the first is that the diaphragm and the sternum, which had contracted during inspiration, now they relax. Relaxation of diaphragm and sternum takes place. During inspiration, as the air went inside the tracheal system, the thoracic chamber expanded. There was an increase in the volume of the thoracic chamber. But here just the opposite happens, because the air is going to be released out. So there is a decrease in the volume of thoracic chamber. There is a decrease in the volume of the thoracic chamber. During the process of inspiration, the lungs had expanded because the air had gone inside the lungs. Now the lungs are going to contract. So contraction of lungs take place. During the process of inspiration, the pressure inside the air had become less. So air from outside rushed into the lungs. But here is just the opposite. Here during expiration, the pressure inside the lungs increased. So what is going to happen? Now here the atmospheric pressure has become less and the internal pressure has become more. So naturally the air is going to rush out from the lungs to the atmosphere. So pressure inside the lungs increase and air rushes out into the atmosphere from inside. So it goes out of the lungs. So in this way, the mechanism of breathing is complete, including inhalation, exhalation, or inspiration and expiration. The parts that are involved are the intercostal muscles, the rib cage, diaphragm and sternum, and the thoracic chamber. So, and the total breathing rate is 12 cycles per minute. Means in 1 minute, 12 times the breathing mechanism takes place.